First time I was technically like admitted to a psych ward was when I was 10. Actually, I had my 11th birthday there. It was at Rady's. It's just sad because they didn't even give me any cake. They said they would, they didn't. Most recently was September of last year. I was at Mesa Vista, where they have you wear ankle monitors. Or like ankle bracelets, I can't remember what it is. When I was in residential, the people there were really nice. Especially my roommate. I really enjoyed staying up late with her and just making up like stupid sayings and just like just talking and just acting like we were actually our age, just like at school, just talking with your friends, and when in reality it was like we'd be like talking from 9, which is when we had to be in our rooms, to like 3 in the morning. Like, I can't remember the last time I had someone to talk to that we had that much to talk about, where we had to be told to be quiet by some of the night staff, because we didn't want to go to bed, and we just kept talking and having fun. From my experience, the staff at mental health facilities, like the psych ward and residentials and PHPs and IOPs, some of them treat the patients more like fragile dolls than actual people, which I find to not be very good when you're trying to, get better. The rules made it so that the staff had to treat us like we were like toddlers. But at Res, the staff were a lot more understanding, as some of them had also gone through similar situations. So it was like a lot better than the mental hospital in that fact. But there were still things happening there that some of the staff had to, the rules some of the staff had to follow of like how to treat us, that was still pretty messed up, or just weird. It really did not help with my attachment issues, because, for example, the psych ward, basically you go in at your most vulnerable point, and you're around a bunch of other kids who are at like their most vulnerable points, and you've gone through similar situations, and then you're only around them for like a week, and you really, really get to know them when they're in when they're just like themselves, and they get like really comfortable around you, you get really comfortable around them, and then you have to leave, and you're not allowed to share contact information, and even if you do, no one's actually gonna contact either. If you get the contact information, most likely you're gonna forget to contact them. If they get your contact information, they're most likely gonna forget to contact you. I would have to say what keeps me going is the fact that there are are people I've met while I was in the mental health system, and they've told me that, like, before I would leave like a psych ward or PHP or an IOP, some of the people I would get like the closest with would like either write me a note or tell me that that like I helped them like have something to live for, or find something to live for. So I feel like if I'm able to do that for others, I should like keep going so that I hopefully can like continue to do that for people and help them get better.